Okay, good morning Queensland, and good morning people living in Inala and Richlands. It's lovely to be in my electorate, and of course there are a lot of distribution centres here that contain a lot of health supplies that we're getting out to people right across Queensland, especially the southeast, as we have distribution centres in other parts of our state. Today I can report that we have 6,031 new cases, and that includes about 4,809 rats. It's again my sad duty to report that tragically 13 people have lost their lives today as a result of COVID. And once again, can I express my condolences to the family members of people who have lost loved ones. It's absolutely tragic, and I feel this, everyone feels this. It's awful to have to report these deaths each day, and I know that the Chief Health Officer and the Health Minister feel it as well. The Chief Health Officer will talk about the numbers in ICU and the numbers in hospital. 37,121 tests in the last 24 hours. 91.76% of Queenslanders have had at least one dose of the vaccine, which is fantastic. And in great news, we're at 89%, and of course double dose, which of course means that tomorrow the restrictions on vaccinated people coming into Queensland is lifted. So once again, that's good news for families wanting to be reunited without having to do quarantine. Now the next thing is about our boosters. So we've had 1,093,000, so 62% of the eligible people have received their booster shot. We know that those boosters are an added layer of protection. So from Monday, we are cutting that eligibility to 3 months, down from 4 months. So our pharmacists will be prepared, our GPs will be prepared, our health centres will be prepared. So that brings us in line with what other jurisdictions are doing as well. The Chief Health Officer advised me this morning that it is safe to do that. So can I say to Queenslanders, if you are due to have your booster, please come and get your booster. It is that added layer of protection. Now, of course, we have 2 weeks until school starts, except for our Year 11s and 12s will begin that remote learning 1 week earlier. But can I please say to parents, you now have that 2 weeks to get your children vaccinated. Very, very important. Please don't delay. And we already have 20% of our children between that 5 to 11-year-old bracket that have had their vaccine. We've got 2 weeks to really increase those numbers, and it's great to see that children are coming out and getting their vaccine. And look, they are very well aware of this pandemic. I know my nieces and my nephew talked to me about this. They were very keen to know when they were getting their vaccine because their parents had had their vaccine. So please think about the next 2 weeks booking your children in for a vaccine. Okay, I just want to talk briefly about RATs, the rapid antigen tests. So, of course, today we were out at one of our distribution centres where 1.5 million additional rapid antigen tests have come in, which is great news. We've got 2 million that will be coming in over the next couple of weeks, and these are going out, of course, to our health services and our health testing centres for the public and for our staff. So we've also got a new distribution centre at Richlands, which is under construction. And of course, the Deputy Premier talked yesterday about a couple of companies that we hope to get approvals soon so we can do local manufacturing right here in Queensland. And National Cabinet yesterday, I raised this issue, and can I thank the Prime Minister? He said that the TGA will work closely with the state government to iron out any issues that those companies may have to facilitate their accreditation as quickly as possible. They have to go through the normal processes, but if there are any issues that either party needs, we will fast track those issues and work with the federal government to really accelerate the approvals of those companies, and I thank them for that. I want to thank Queenslanders for everything that they're doing. Also, too, can we give that reminder that, if you have had your booster and you're double vaccinated, please go out and live your life, but make sure you've got your mask as that added protection as well. And once again, can I just reiterate, as we reach the peak over the next 2 weeks, for our elderly and more vulnerable people in our community to think about limiting their movements. We know this is happening in other states. We know that this is happening in Queensland, and I thank people for listening to this health advice. But if you are young and fit, you're double vaxxed and you've had your booster, there is no reason why you should not continue to go about your normal life. I see that there have been some calls today from mayors to drop that check-in app. Can I just say that's not happening? We are going through a wave at the moment. We're going to be peaking in the next 2 weeks. I need people to continue to check in. That is to ensure that vaccinated people are going into certain venues so they can feel safe during this particular period of time. It's an added layer of confidence for individuals and for families. I have conveyed that to the Lord Mayor this morning as well of Brisbane, Adrian Schrinner. Secondly, if there is a big outbreak, we also want to make sure that we can actually let people know from those venues. So that check-in app will be in use for the foreseeable future. So we'll review that, of course, once we get through this wave, but please, I would urge people to still continue to check in. Okay, I'll hand over to the Chief Health Officer, then the Health Minister, then we're happy to take some questions.
Thank you very much, Premier. So sadly today we have 13 deaths to report, 2 people in their 60s, 5 in their 70s, 5 in their 80s, 1 person in their 90s. Of those, 2 were unvaccinated, 1 had received only a single dose of vaccine, 8 had received 2 doses, 1 had received a booster, and we don't have confirmation of one of those patients, and our thoughts are very much with the families today. We now have a total of 855 people in hospital with COVID-19. That's up by just a small amount from yesterday, from 850. And that includes 54 patients in hospital intensive care units, 22 of whom were ventilated. That's up from a little bit from 48 from yesterday. I just want to make something absolutely clear, so there's no doubt in anybody's mind. Were it not for the wide-scale vaccination of Queenslanders today, we would not be talking about 855 people in hospital. We would not be talking about 855 people in hospital. We would be talking about thousands of people in hospital, and almost certainly our hospital system would be overwhelmed by now. And we know that from the relative risk of being admitted to hospital for the vaccinated versus the unvaccinated, whether it's 2 doses or 3 doses. We certainly know that the booster reduces your risk of being admitted to hospital further than 2 doses, but 2 doses very substantially decreases your risk of hospitalisation as well. So I'm just going to say that again. Were it not for wide-scale vaccination in Queensland today, we would not be talking about 855 people in hospital. We would be talking about thousands of people in hospital, and almost certainly our hospital system would be overwhelmed by now. In terms of the booster program, we've now vaccinated, given 1,093,798 boosters to those people who've received vaccination, their second dose 4 months or more ago, and there is capacity in our system to vaccinate more. So I would encourage those people to come along and get vaccinated as soon as possible. If you can't get in through one, there are multiple ways in which you can get vaccinated, your general practitioner, through pharmacies or through Queensland Health sites. There is capacity in the system for those who need a booster. So I would encourage them to come along. I'll now hand over to the Health Minister.
Thank you. So I do want to acknowledge the deaths of those individuals and condolences to the families and friends of those individuals. Once again, only one of those individuals had had a booster, so I do encourage people to come forward and get their booster. We know that there is just under 40% who are eligible right now for a booster who haven't come forward, but with this change on Monday where you'll be able to come forward from 3 months, that'll be even more people in the community who are eligible. And so I say to anyone who had their second dose in October last year or earlier, then you should be coming forward to get your booster as quickly as possible from next week. Now, pharmacies, GPs will be offering the boosters, as will our public vaccination sites as well. And I thank the Pharmacy Guild and the GPs. I spoke to the Royal Australian College of GPs, the AMAQ, and also the Pharmacy Guild yesterday, who welcomed this announcement, and we're giving them a couple of days lead in so they can communicate to customers and let them know their eligibility and make sure all of the stores and the GPs and the pharmacists around Queensland will know who is eligible when they come in next week. But this will allow a lot more people to come forward and get vaccinated sooner, and we know the difference that the booster can make. So please come forward, get vaccinated. Of course, I want to thank our staff who have been handing out the rapid antigen tests at our testing clinics as well. We ask for everyone's patience and respect, whether you are trying to get a booking or walking in for vaccinations, again, whether it's GPs, pharmacies or public clinics, and also if you're lining up to either get a PCR test or hoping to get one of the rapid antigen tests to take home. Please show respect to our staff, be patient, and also show respect to our staff in our hospitals who are doing an incredible job at the moment.
Dr. George, can I just quickly ask you, I'm just checking, 6,000 patients today, or is it 16,000? Sorry, 16, I think it said 6, so great, 16, all right, I was just wondering if there was a massive drop.
16,031, of which 4,809 were positive rat tests.
Can you clarify with the rat? People will be hearing, 1.5 million are coming to Queensland, great, how can I get one of them? Can you explain who can get one and how they can get one from our health service?
Well, in terms of the way we are working, so we're giving rapid antigen tests to people who come to the fever clinics, those who are the sixth day of their quarantine period, and also those who we can't get need one urgently and can't get a PCR at the clinic.
So it's not like people can just turn up there and say, hey, I need one to put in my cupboard.
No, not at all. And I understand that. I've forgotten where I was.
People will be hearing that there's 1.5 million that have arrived in Queensland. Can people just turn up and get one?
No, not at all. I mean, the rapid antigen tests will also be used in the hospital system, in the emergency departments and stuff. Will be used in a variety of areas. Yes, and I understand also that there additional supplies are arriving in retail outlets in the coming days and weeks as well. So for the sort of purposes you're talking about, I think maybe we should be relying more on the retailers than on Queensland Health.
Oh, hang on, can I just also address something else? So just before we finish about rapid antigen test too, I just wanted to say I initially advised Queenslanders that we had ordered 18 million. We have now increased that order to 23 million. Of the rat tests. So, sorry? They're a combination of needed for close contacts, but also to, as Dr. Gerard said, for our workers in the health system as well. Sorry? When do you think people at home will be able to get their hands on the test? Well, if you're a close contact, you can go to one of our fever clinics and get them. They've already been distributed out to the fever clinics, which is great news. And as I said, we just looked at 1.5 million that have just arrived in, which is fantastic at the previous facility. And we've got 2 million coming in the next couple of weeks, so they're coming in. but also too I'm hearing that some of the other companies are getting them in through different retail outlets as well. So at the moment there is of course a huge demand on these.
Are you considering giving them to any other services apart from health staff?
Not at the moment, but we're going to have a huge amount coming in, so of course we'll be looking at that in the future. I'm not going to comment any further until Cabinet considers that. Can I say that Cabinet will be considering those matters before Parliament resumes? I think as the public are aware, we are going through this wave at the moment. The focus of the first meeting next week is going to be firmly on dealing with this Omicron wave. I convened my Cabinet Budget Review Committee last week to discuss a whole range of issues, and the focus next week is on the peak over the next 2 weeks, which I think the public would absolutely expect us to be focused on. And I give my guarantee that before Parliament goes back, I'll be making comments about the report into the CCC. I've read some of it, yes I have. Sorry? I've read some of it. Because I've been dealing with a peak wave, okay? That's why. Sorry? Yeah. And guess what? The whole of Cabinet will be considering it.
You previously said that you didn't support unexpired price for
I'm not making any further comments. That's a matter for Mark McGowan. That's entirely, he is the Premier of his state. I'm not making any comments about what he's doing. No, that's.
You advocate for Queensland as a relative they want to see in Western Australia?
I think he's put in some, from my understanding of what he announced, he's actually put in some compassionate grounds, and I know there's a lot of people here who've got relatives over there as well. That is a matter for him. Let me say very clearly that, over a month ago, we didn't even know about this Omicron wave, okay? And at the moment, my focus is on dealing with the issues at hand that are happening in Queensland.
Are you surprised or concerned that the US and EU have placed Australia and obviously therefore Queensland on their no-fly list?
Well, that would be for people coming in to. Well, look, there's going to be a lot of people that want to see their family and friends. There are still business that needs to happen. I know business companies, representatives are travelling overseas to do what they need to do, and people will be coming here likewise. So until I see some numbers from the international flight arrivals, but the airlines would have a better idea about who's coming and who's going. And we're going to see this happening. Everyone, let's be aware. We are actually going to see this happening over the next year in terms of as different countries go through different waves. Yep, and I raised it at National Cabinet, and a very good outcome there where the Prime Minister said that they would nominate someone from the federal government to work with a senior person from the state government. So I think that's a good outcome. I think everyone realises if we can have domestic capability here of manufacturing, that's a good thing. So we are really pushing that very hard. Lydia, you were screaming at me to open the border. I find it a bit ironic that you asked me that question now. I said very clearly at the time, no I don't, because I said very clearly at the time that the federal government had all the information in relation to the Omicron variant and they said it was safe to do so. Now what I'm concerned about is I want our children to get vaccinated and I want the booster shots done. No, I think that's a great start, and we've got 2 weeks to continue to get our children vaccinated.
We have on Monday that children of essential workers are able to
Yes,
vote.
they are.
Have you made any decisions around any sort of mandatory testing, face masks, anything like that?
We will be releasing our back-to-school plan on Monday after Cabinet. Cabinet will be considering that matter on Monday as well. But let me say this, there is no health advice. AHPPC has not advised that there needs to be testing of children at this stage.
And
Yep.
I guess that would also include whether or not there would be a further delay to the start of school?
No, there's no further delay.
I've been told by a nurse, apparently they're starting to give the full booster to some people in high risk groups after vaccination.
I'm not aware of that. I might get Dr. Gerard to comment on that. Any further questions for me?
Sorry,
Yeah.
obviously you can still, businesses can still check the vaccine certificates without people checking in. So it seems you're checking out. The main purpose, as you say, is to check in and obviously monitor the cases of mass outbreaks and contact people. How many times has the government contacted people over the last few weeks in a mass?
Well, we'll get that information for you, but it also is showing people that they are vaccinated as well. This is going to remain in place during this wave. Let me make that very clear.
Can I just clarify, you said that people have their reasons to go about living their lives. What about people who haven't been eligible?
The booster gives you that added layer of protection, and if people are wearing face masks, they will make their own decisions. But my comments have been directed at the more vulnerable people in our community. You can go back and look at everything I've said. I have been very, very consistent here. If you are a vulnerable member of the community and you are elderly and you have not had your booster, for the next couple of weeks, you should really think about your movements. Now, what we are seeing, you only have to look at the tragedies we are reporting every day, that most of the people are the senior members of our community. So I'm asking people to think very carefully. If you are a member of our seniors community, trying to keep people safe here, please think about where you're going and think about if you need to go into a large crowded situation. That's not saying don't see your families. That's not saying don't go and do your shopping. Okay, I've got parents in that age group. They're still going and doing their shopping. They're still seeing their family, but they're not going out to a party. Okay, so it's about thinking about your movements over the next 2 weeks as we go into this peak of this Omicron variant.
Do you have a number, Premier, for what we expect to reach at the peak? Like, what are the hospitalisation numbers?
Well, look, we don't know because at the moment it's lower than what's expected, and there's a range between a low and high, and we are working through this. Cabinet will be going through this in some detail on Monday.
The hospitalisations are lower than expected.
At the moment they are, but we have not gone through the peak yet, so I do want to brace Queenslanders for the fact that things are going to get worse before they get better. And we've seen the numbers in New South Wales in the past have gone higher, and we've seen a large number of deaths reported today as well.
Premier 3 months ago from today,
yes.
There were 58.7% of Queenslanders with the second dose. It still leaves a lot of Queenslanders who don't have the eligibility, doesn't it?
We're at 89% double dose, which is fantastic. I mean, that is fantastic. I mean, my whole cabinet went out and did a campaign across Queensland. I don't think there's one person that can say that we have not offered everyone the opportunity to get vaccinated. But now I'm saying to Queenslanders that added protection is that booster. So if you are eligible after 3 months, you can now come forward and get that booster.
42% of people, I beg your pardon, 58% of people will be eligible.
Do we know how many more? Like, is it how many more?
We'll get those figures for you. We'll get those figures for you. Sorry? I don't have those figures. You can get those from the police. They have those figures. Yes, Lydia.
Adrian's going to say that now we're at 90% or around 90% double dose. Unvaccinated people shouldn't be put down by etc. Do you agree? And when do you expect to?
No, I don't agree, and I respectfully disagree with that. Adrian and I get along very well. We work very cooperatively when it comes to the Olympics and other matters about livability in Brisbane and Queensland, but on that one I respectfully disagree. We review these issues regularly, and at the moment we still want to drive that vaccination rate up. And as you saw today, I think what did I say? We're at over 91.76. I mean, in ACT they're like at 97, 98. New South Wales and Victoria, I think from memory, around 95. I'd like to see that up. And Queenslanders can do it because if you think about it and you go back to it and you have a look at places like Central Queensland and Mackay, they were some of the lowest regions for vaccination, and now Mackay is one of the highest regions in the state with over 95% first dose. So,
We might not know this, maybe it's just so much.
we might go to the Chief Health Officer.
Has Novavax arrived here in Queensland yet?
Okay, what I can say there is we were advised at National Cabinet yesterday. Now, people have stopped me about this as well, so people have stopped me and said I'm waiting for Novavax to arrive. It's a very, very small cohort of people, but they should be aware that my understanding is that the TGA have approved Novavax and now it's going to a ATAGI. So we're waiting for that further approval. So that's with the federal government at the moment. The Deputy Premier addressed that the other day, and WellCamp is going to be used for a whole range of facilities, a whole range of reasons, and it's great that we will have a quarantine facility that is absolutely needed, and it will be needed at some time. It could also be used for future outbreaks of pandemics as well. So we have that extra facility, and I'm very proud that it has been completed in such a short period of time. I'll find that out. Talk to Steve.
Why didn't we appoint the quarantine commissioner back when WellCamp was announced, when Queenslanders were getting locked out of their own state and couldn't get back?
Because this is about running the facility. Okay, this is about running who's going to go into that facility. Yep. No. Okay, that's enough now. All right, I think we're just going around in circles. We'll ask the Chief Health
I wouldn't
Officer.
mind saying a couple of things about vaccination, Premier, if that's okay, if you're happy with that. I just want to clarify a couple of things. Thank you. 2 doses of vaccine offer substantial protection against hospitalisation, particularly if it's given in the last few months. That's the first thing I want to say. Secondly, the unvaccinated are making up a disproportionate number of patients that are currently occupying beds in our hospitals, and that's why we need to protect them from getting infected in crowded environments. Thirdly, we have given 1,093,798 booster doses to Queenslanders, and there is capacity in the system. The vast majority of vulnerable and elderly people in Queensland should by now have been able to gain access to a booster dose if they sought it. They should by now. There will be a small proportion that won't, who got their second dose of vaccine very late, but the vast majority should have been able to access that booster dose by now.
And are some people receiving their fourth
The fourth booster applies to people with severe immunosuppression, so that'll be people who've had kidney transplants and such like that. There are specific provisions within ATAGI to do that. They should be able to if they fulfil the criteria. There's people with severe immunosuppression. I assume that's what you're referring to.
Just one more question. There's a lot of talk in other states about mandating the booster shot.
We're not considering that at the moment.
But will it get to a stage, though, where people have had the vaccine and the boosters put their jury back out again?
It's very speculative, but we're not considering that at the moment. Thank you. Thank you.
A personal question. With boosters? Yeah. I had my third booster yesterday.
Yeah.
And